As we get older, protecting our hearts becomes more important than ever. Most of us already know that. We hear it from doctors, from family, from the news. Eat better, move more, reduce stress, take your medications. But today, I want to ask you a different question. What if one of the biggest risks to your heart isn't your diet, your stress level, or even your genetics? What if it's sitting quietly in your medicine cabinet? Many older adults are surprised to learn this, but cardiologists and pharmacists have been raising concerns, not about rare diseases or complicated surgeries, but about everyday medications. Pills that are FDA approved, pills that are commonly prescribed, pills that millions of seniors take every single day, often for years. The issue isn't that these medications are bad. The issue is that aging bodies handle medications differently. As we get older, our kidneys slow down. Our liver processes drugs more slowly. Our blood vessels stiffen. Our balance changes. A medication that worked well at 50 or even 60 can behave very differently at 70 or 80. And here's the part that worries many experts the most. Most seniors are never warned. Prescriptions get refilled automatically. Side effects like fatigue, dizziness, or swelling are brushed off as just getting older. And dangerous drug combinations are often missed, especially when multiple doctors are involved. So today, we're going to slow things down and take a closer look. In this video, we're counting down 5 pills that may quietly damage the hearts of older adults, especially after age 60. Some of these medications may already be in your home. Others might surprise you. This is not about fear. It's not about telling you to stop your medications. And it's definitely not about blaming doctors. This is about awareness, understanding, and asking better questions. If you're over 60, or if you care about someone who is, stay with me. Because what you're about to learn could help protect your heart, your balance, your clarity, and your independence. Let's begin with number 5. Number 5, ibuprofen and NSAIDs, the hidden strain on aging hearts. Ibuprofen, naproxen, diclofenac. These pain relievers are everywhere. They're in kitchen drawers, bathroom cabinets, and bedside tables. Many people have taken them for decades without a problem. When arthritis flares up, when your knees ache, when your back feels stiff in the morning, it's easy to reach for one and move on with your day. But after age 60, these common pain pills can quietly place extra strain on your heart. These medications belong to a group called NSAIDs, nonsteroidal anti-inflammatory drugs. They reduce pain and inflammation, but they also affect how your kidneys handle salt and water. In younger bodies, the kidneys usually adjust. But as we age, kidney function naturally declines, even when lab tests still look normal. That decline can cause the body to hold on to extra fluid. You might notice your shoes feel tighter. Your ankles look a little swollen at the end of the day. Your legs feel heavier. You feel more tired than usual. Many people assume this is just aging, but in many cases, it's your body telling you something important. Extra fluid means your heart has to work harder. For older adults, especially those with high blood pressure, heart disease, or diabetes, this added workload can worsen heart failure or destabilize blood pressure. NSAIDs can also reduce blood flow to the kidneys themselves, creating a cycle that slowly increases strain on both the kidneys and the heart. Over time, regular NSAID use has been linked to higher blood pressure, kidney problems, and an increased risk of heart attack and stroke, especially when taken daily. The risk increases even more when NSAIDs are combined with other medications like diuretics or certain blood pressure drugs. What makes this situation so tricky is that you don't feel it happening. You don't feel your kidneys struggling. You don't feel your heart working harder. You just feel a little more swollen, a little more tired, a little more unsteady. And because these medications are sold over the counter, they feel harmless. But common doesn't always mean safe, especially later in life. If you're over 60 and taking NSAIDs regularly, this is a good conversation to have with your doctor. You may not need to stop them completely. Often, using them occasionally instead of daily can make a meaningful difference. For some people, safer options include acetaminophen, topical creams, gentle stretching, heat therapy, or physical therapy. The goal isn't to ignore pain. It's to manage pain without quietly increasing risk. Because what feels like a small pill can have a big impact on an aging heart. Now let's move to number 4. This one isn't for pain. It's often prescribed for sleep or anxiety. And while it can feel helpful at first, it may slowly take something very important away. Number 4, benzodiazepines, the sleep aid that can steal your stability. Medications like lorazepam, temazepam, and diazepam are commonly prescribed to help with sleep, anxiety, or nervousness. For many older adults, they feel like a relief. Finally sleeping through the night. Finally feeling calmer. Finally getting a break. But here's what many people aren't told. These medications slow down the brain and nervous system. That's how they create calm. That's how they create sleep. But in older adults, that slowing effect can go too far. Reaction time becomes slower. Balance becomes less steady. Muscle coordination weakens. That's why benzodiazepines are strongly linked to falls, especially nighttime falls when grogginess is at its peak. And falls at this age are serious. They're one of the leading causes of hospitalization and loss of independence in seniors. But the concern doesn't stop with balance. Long-term use has also been associated with memory problems, mental fog, and increased risk of cognitive decline. These changes often happen slowly, so people rarely suspect the medication. Another issue is dependence. Over time, your body adjusts. The same dose doesn't work as well. Stopping suddenly can cause anxiety, restlessness, poor sleep, or shaking. So people stay on the medication not because it's still helping, but because stopping feels worse. If you're taking a benzodiazepine, the most important thing is this: do not stop suddenly. Instead, talk with your doctor. Many people can taper slowly and safely. Others can explore alternatives that don't carry the same risks. Non-drug treatments like cognitive behavioral therapy for insomnia work extremely well for sleep problems in older adults without side effects. Gentle movement, breathing exercises, and other approaches can help anxiety without affecting balance or memory. Because that pill that helps you drift off might also be quietly pulling away your steadiness, your clarity, and your confidence. If this information has been helpful so far, take a moment to like the video and subscribe. It helps this channel reach more seniors who need clear, calm health information. Now let's move to number 3. Number 3, proton pump inhibitors. The silent drain on strength and resilience. Heartburn and acid reflux become more common as we age. Slower digestion, changes in muscle tone, and certain foods or medications can all contribute. To manage this discomfort, many seniors are prescribed medications like omeprazole, pantoprazole, or esomeprazole. These medications are known as proton pump inhibitors or PPIs. Used short-term, they can be very effective. They reduce acid, protect the esophagus, and allow irritated tissue to heal. For ulcers or severe reflux, they can be absolutely necessary. The concern begins when short-term treatment quietly turns into long-term daily use, often for years, without a follow-up conversation about whether the medication is still needed. And this is where problems can slowly develop. Stomach acid isn't just there to cause discomfort. It plays a critical role in digestion and nutrient absorption. Adequate acid is needed to absorb calcium, magnesium, iron, and vitamin B12, nutrients that are especially important for older adults. When stomach acid is suppressed for too long, deficiencies can creep in silently. Low calcium weakens bones and increases fracture risk. A low magnesium can disrupt heart rhythm, worsen fatigue, and increase muscle cramps. A low vitamin B12 and iron can contribute to anemia, nerve damage, balance problems, memory issues, and mental fog. These symptoms often develop gradually. Fatigue, weakness, tingling, or confusion may be blamed on just getting older, when in reality, the body is struggling to absorb what it needs. Research has also linked long-term PPI use to a higher risk of kidney problems, intestinal infections, and potential cardiovascular concerns, particularly in older adults. To be clear, PPIs are not bad medications. They can be life-saving in the right situation. The problem is that what was meant to be temporary often becomes permanent out of habit, without reassessment. If you've been taking a PPI for months or years, it's worth asking your doctor, is this still necessary? Can the dose be reduced? Can it be used only during flare-ups? Is a gradual taper appropriate? Because relief today should not come at the cost of strength, balance, and resilience tomorrow. Number 2, heart and blood pressure medications. When the dose no longer fits, heart and blood pressure medications save lives. There's no debate about that. They lower the risk of heart attacks, strokes, heart failure, and hospitalizations, and for many people, they are essential. But what's often overlooked is that aging changes how the body handles these medications. As we get older, the kidneys and liver slow down, meaning drugs stay in the body longer. Muscle mass decreases, body fat distribution shifts, and the nervous system becomes more sensitive. Together, these changes can make medications feel stronger, even when the dose hasn't changed in years. In other words, the same prescription that worked beautifully at 50 may be too aggressive at 60. Certain heart and blood pressure medications can quietly contribute to weakness, instability, and reduced quality of life. Diuretics, often prescribed for blood pressure or heart failure, can cause dehydration and low levels of sodium or potassium. This may lead to fatigue, muscle weakness, confusion, and dizziness, especially in warm weather or during illness. Calcium channel blockers can cause swelling in the legs and feet, a heavy or achy feeling, and persistent tiredness that makes walking and daily activities more difficult. Beta blockers slow the heart rate and reduce adrenaline. While this protects the heart, it can also blunt energy levels, reduce exercise tolerance, and make seniors feel unusually tired or short of breath with mild activity. Individually, these medications may be appropriate. The problem arises when several are taken together, each added during a different stage of life, often by different specialists. Over time, the combined effect can cause dizziness when standing, low blood pressure, balance problems, general weakness, falls that seem to come out of nowhere in many cases. The heart condition itself hasn't worsened. The body has changed, but the treatment hasn't been adjusted to match it. Which brings us to the most important point of all. Number 1, polypharmacy, when the most dangerous pill is the combination. Polypharmacy means taking 5 or more medications every day, and it has become extremely common in older adults. Each additional pill increases the complexity of the system and the risk. With every new medication, the chances rise for side effects, drug interactions, memory and concentration problems, balance issues, fatigue, and muscle weakness too often. These changes are dismissed as normal aging. But in many cases, they are medication effects in disguise. A pill for sleep may worsen balance. A pill for pain may cloud thinking. A pill for blood pressure may drop it too low. The result is a slow erosion of independence, without anyone realizing why. The solution is not stopping medications suddenly, and it's certainly not ignoring medical advice. The solution is reviewing everything. A structured medication review with a physician or pharmacist can be transformative. Medications that are no longer necessary can be reduced or discontinued. Doses can be adjusted to fit the aging body. Harmful combinations can be identified and corrected. Many older adults report dramatic improvements after a careful medication review. Better balance, more energy, clearer thinking, and fewer falls. And here's the key. These benefits often happen not because something new was added, but because something unnecessary was removed. Think about it. Every pill in your system has a purpose, but every pill also comes with potential side effects. When we accumulate medications over decades, small side effects can quietly add up, slowing us down, clouding our thinking, and increasing the risk of falls. Removing or adjusting just 1 or 2 of these medications can sometimes restore a level of vitality and clarity that people had forgotten was possible. This is why, in medicine, more isn't always better. Sometimes, the path to better health isn't adding another pill, another supplement, or another treatment. It's about simpler, smarter treatment, making the system work for you, not against you. If this video has helped you understand how medications may be affecting your energy, balance, or mental clarity, please like and subscribe so more people can benefit. And I'd love to hear from you in the comments. How many medications do you or a loved one take? Sharing your experience might help someone else feel less alone, and could even inspire them to have that important conversation with their doctor. Because here's the truth. Asking questions about your medications is not being difficult. It's being informed, it's being proactive, and it's being wise. It's advocating for your own health, protecting your independence, and taking control of your quality of life. Remember, no one knows your body better than you do. Small steps like reviewing medications can have big, life-changing effects. And it all starts with curiosity, awareness, and the courage to ask the right questions.